Rachel. I'm Billy. I'm a PA student, and I'll be doing your musculoskeletal physical exam today. I'll start by washing my hands. Would you like some?
Yes.
Coronavirus, am I right? So what brings you in today?
Wrist pain.
Oh, very generic. Sounds good. Well, we'll take a look at that. I'm just going to start by palpating your radial pulses. Feel good. Alrighty, next I'm just going to start by inspecting your hands and wrists. So I'm looking for any erythema, ecchymosis, asymmetry, deformity, or nodules. If you could flip them for me. Perfect. Alrighty, I'm going to start by, which one's the affected one?
The right one.
Okay, sounds good. Alrighty, so I'm just going to start by feeling your joints of your wrist and your fingers, feeling for any tenderness, heat, nodules, or crepitation. I'm going to do the same for this one. Same thing, just feeling any pain with any of that.
Nope.
Alrighty. Now I'm just going to check the bony landmarks of your hand and wrist. So you can come a little closer. So we have your distal ulna, your distal radius. If you flex your hand like that for me, your thumb kinda, is your anatomic snuff box. We have your carpals, your 5 metacarpals, your MCP joint, and then your distal interpharyngeal joints, your proximal pharyngeal joints, your PIPs, and then your phalanges, so your distal, medial, and proximal. Perfect. I'm just going to do the same thing with this hand. So again, the distal ulna, distal radius, flex your thumb, anatomic snuff box. Any pain with that?
Nope.
Carpals, metacarpals, your phalanges, your MCP joints, DIP, and PIP joints. Good. Everything looks great. Alrighty, moving on to some active range of motion with your wrist and hands. So we're going to start by flexing our fingers, extending our fingers, abducting, adducting, thumb. This is abduction, adduction, flexion, extension. Good. Now opposition, touch your fingers. Good. We're going to have wrist flexion, wrist extension, and then ulnar deviation and radial deviation. Good. Any pain with any of that?
Nope.
Alrighty, perfect. Next we're going to go into some special hand tests. So I'm going to start by doing the Phelan's test, which is to assess for carpal tunnel syndrome. So I'm going to have you doing your hands like this and just push against your wrists. And we're going to do this for 60 seconds because this is the same test. We also do this test for the cubital tunnel syndrome of the elbow. And the only difference is that when assessing for carpal tunnel, you hold it for 30 seconds, but when you do it for cubital tunnel, you do it for 60. So we're just going to get feed 2 birds with one scone. That's the phrase we like to use in the program. Alrighty. Any tingling in your fingers?
Nope.
Alrighty, good. Next we'll do the Tinnell's test to assess for carpal tunnel. I'm just going to tap on right over your carpal tunnel a couple times. Any tingling in your fingers?
Nope.
Good, we'll test this hand just to be sure. Same thing. Any tingling?
Nope.
Perfect. Moving on, we will do the Finkelstein test to test for de Quervain's tenosynovitis, which is inflammation of the abductor pollicis longus and the extensor pollicis brevis tendons. So what you're going to do is you're going to put your thumb inside your hand like this, and I'm just going to ulnar deviate down. Any pain with that over your snuff box?
Nope.
Good. And then the last test we're going to do for the hand and wrist is we're going to do the Frohman's test to assess for ulnar reticulopathy. So what I'm going to have you do is grab the piece of paper, between your thumb and index finger like that, and now don't let me take it away. Good. Other hand. Don't let me take it away. Good. And I'm checking for compensation and thumb flexion, but I didn't see anything. All right, next, before we go into the more specific elbow and shoulder exams, I'm going to do some strength testing. So we'll start with your shoulders. I'm going to have you straighten your elbows for me, and now go ahead and push against my hands for shoulder flexion, pull back, shoulder extension, put your arms to your side, push against my hands for shoulder abduction, and against for shoulder adduction. Good. Next, I'm going to have you flex your elbows, and I'm going to have you pull towards your shoulders for flexion, elbow flexion, and down for elbow extension. Good. Next, we're going to do the wrists. So I'm going to have you push down for wrist flexion and push up for wrist extension. Next, we'll do grip strength. So I'm going to have you grab onto my fingers and hold it, squeeze as tight as you can. Good. Next, we'll check for thumb opposition against resistance. So I'm going to have you try and touch your pinky. Good. Other hand, touch your pinky. Good. And finally, we're going to do the abduction and adduction of your fingers against resistance. So we'll just do one at a time. So we'll do abduction. Good. Good. Spread apart. AB. Other hand. Spread apart. Good. Spread apart. Good. Spread apart. Good. And then we're going to push together for adduction. So push together. Good. Push together. Push together. Good. Push together. Push together. And push together. Good. So your strength is intact bilaterally in all joints. So that's great. Moving on to the elbow. I'm going to start by inspecting the elbow, looking for any erythema, ecchymosis, swelling, nodules, deformities, asymmetry, all that fun stuff. I'm just going to have you relax, and I'm going to bend your elbow here, and I'm just feeling the joint for any tenderness, heat, nodules, or crepitation. Any pain with that?
Nope.
Alrighty, good. Next, you're going to feel for some bony landmarks. So you have your olecranon, you have your lateral epicondyle, your medial epicondyle, your cubital fossa, and your radial head. Good. Next, we'll do some active range of motion with your elbow. So again, flexion, extension, straighten it all the way. Perfect. And then pronation, supination. Any pain with any of that?
No.
Good. Moving on to some special tests at the elbow. We'll start by doing the valgus stress test. So I'm going to hold your arm at about a 30-degree angle, and just going to have you relax. I'm just going to apply some valgus stress. Any pain?
Nope.
Okay, good. Then we already did the Phelan's test for cubital tunnel syndrome. And this was to test for ulnar collateral ligament laxity, the valgus stress test. We already did the Phelan's, and so we'll do the Tinel to assess for cubital tunnel syndrome. So the same tapping motion that I did on your wrist. So just gonna tap a little bit in here. Any tingling in your fingers?
Nope.
Awesome. Next, I'm going to do some tests for medial and lateral epicondylitis. So we'll start with the medial epicondylitis. So I'm just going to palpate for any tenderness of the insertion of the common flexor tendon in the medial epicondyle. Any tenderness?
Nope.
Alrighty, I'm going to have you resist against flexion. So, resist against flexion. Yeah, good. Alrighty, and then I'm going to have you fully extend your wrist all the way and then straighten your elbow. Any pain in here?
Nope.
Good. Next, we'll test for lateral epicondylitis. Again, palpating for any tenderness of the common extensor tendon in the attached to the lateral epicondyle. Any tenderness?
Nope.
Alrighty, I'm going to have you resist against extension. Good. And then for this one, I'm gonna have you fully flex your wrist and straighten your elbow. Any pain in there?
No.
Perfect. Alrighty, that completes our elbow exam. Moving on to the last and final joint is the shoulder exam. So I'm just noting the contour of your shoulder. Looking for any erythema, ecchymosis, deformity, asymmetry, swelling, or nodules, or muscle atrophy as well. So I'm just going to start by palpating. I'm just feeling your shoulder for any tenderness, swelling, crepitation, nodules, moving down, just feeling how it feels, any heat. I don't feel anything, good. Next I'll focus on bony landmarks. So we have the subclavicular, or the sternoclavicular articulation, the acromion clavicular articulation. We have the subacromial space, the biceps groove, and then the insertion of the supraspinatus tendon, all that supraspinatus tendon, all up in there. Okay, everything feels like it's intact. I'm gonna do some active range of motion. Gonna go ahead and put your arm at your side, do flexion, extension, good, abduction, adduction, and go ahead and bend your elbow for me and do internal rotation and external rotation. Awesome, any pain with that? Nope. Perfect. We're gonna go ahead and move on to special tests of the shoulder. We'll start by doing the Hawkins or Kennedy impingement testing to assess for supraspinatus tendinitis. So I'm going to have you lift your arm, bend it for me like this, and go ahead and, or actually I'm going to do it for you. And we're just going to go ahead and cross the body. Any pain or weakness with that? Nope. Perfect. Next we will do the, gosh, there's so many tests. We will do the Gerber sign or the liftoff test. So I'm going to have you kind of turn your back, and this is to assess for subscapular tendon pathology or atrophy. So what I'm going to have you do is put the back of your hand against, just turn your body a little bit, yeah, perfect. Put the back of your hand against, and I'm going to push against your hand and try and lift your whole arm off. Perfect. Any pain or weakness with that? Nope. Good. Moving on to the empty can test to assess for supraspinatus involvement. I'm going to have you put your hand out, tilt your thumb upside down. Wow, it's almost like we practiced this. And I'm just going to push down, and so resist me pushing. Any pain or weakness? Nope. Perfect. Next we'll do the crossover test to assess for AC joint deformity or pathology. So what I'm going to have you do is put your arm out like this again and just cross over. Any pain? Nope. Looking for grimacing, but she obviously didn't, so that's good. And then finally, for the last couple shoulder ones, I'm going to have you laying with your right arm kind of hanging off the table. Oh, I should have moved the other chair. Alrighty, perfect. I'm going to have you scoot just a little bit more so that your shoulder's kind of off the table. Perfect. And what we're going to do for this is we're going to do the anterior apprehension test. And this is to test for glenohumeral joint instability. Sorry, the sun's kind of bright.
It's all good.
So what I'm going to do is I'm just going to flex like this. I'm going to hold your elbow, and I'm just going to slowly externally rotate your hip, looking for any apprehension or grimacing, which you show no emotion. So any pain with that though? Nope. Okay, and then the final test we're going to do is the same. It assesses the same thing, that glenohumeral joint instability. I'm just going to apply some anterior pressure to your shoulder here, looking for any resistance. That's a relocation test. Don't know if I said that or not. Any pain? Nope. Perfect. Alrighty, you can go ahead and sit up. Well, that completes our musculoskeletal exam. I suggest icing your wrist because all your tests came back negative. But other than that, I hope you have a great day. Any questions?
No.
Alrighty. Thank you to my patient and my camera woman, my mom.
I'm going to be doing your musculoskeletal exam, so I'm going to have you stand up, move around a little bit, and I'm just going to be feeling on some of your joints. Is all that okay with you?
Yep.
Are you in any pain today?
Nope.
Have you had any past injuries that would prevent you from doing anything today?
Nope.
Okay, perfect. So we're going to go ahead and get started.
Okay.
I'm going to feel on your cervical spine back here,
Okay.
and I just want you to tell me if you have any pain.
Nope.
Okay, perfect. Now I'm going to have you look to the ceiling. Any pain?
Nope.
And look down. Perfect. Then come neutral. And can you look over your left shoulder and over your right shoulder? And then can you tilt your ear towards your shoulder and the other way? Any pain with any of that?
Nope.
Okay, perfect. Now I'm going to go ahead and move on to your shoulders.
Okay.
Okay, they are very symmetrical. Any pain?
Nope.
Okay, perfect. Now I'm going to have you go ahead and lift your arms above your head and back and cross them over. All right, slight repetition in each shoulder. Okay. Any pain?
Nope.
Okay, now I'm going to go ahead and have you lift them forward above your head.
Okay.
All right, and backwards behind your back. Perfect. Any pain?
Nope.
All right, slight repetition in your right shoulder. And now I'm just going to have you tuck them above your head and behind your back. Any pain?
Nope.
All right, slight repetition in both your shoulders. And now I'm going to go ahead and check your elbows.
Okay.
So, are you able to tap your hands up to your shoulders and extend them out? Any pain?
Nope.
Okay. And turn your hands down towards the ground and back up towards the ceiling. Any pain?
Nope.
Okay, perfect. And now I'm going to go ahead and check your wrist.
Okay.
Is there any pain?
Nope.
Okay, symmetrical. And now can you go ahead and flip your fingers towards the ceiling and down towards the ground? Perfect. And go ahead and bring your thumbs closer together and bring your pinkies out towards your wrist. Perfect. Any pain?
Nope.
All right, I'm going to go ahead and check your fingers now.
Okay.
Any pain?
Nope.
Okay. Now I'm going to hold on to them while you point them towards the ground. Perfect. And up. Perfect. And then flex your hands out and make a fist. Any pain?
Nope.
All right, no repetition. I'm going to go ahead and feel your knees.
Okay.
Any pain?
Nope.
All right, can you kick your feet straight up and back down? All right, repetition in both. Any pain?
Nope.
Okay. Now can I take your shoes and socks off to feel your ankles?
I can do it.
Okay. All right. I'm gonna go ahead and feel your ankles. Any pain?
Nope.
Okay. Go ahead and flex your feet up and down. Up again one more time. Any pain?
Nope.
All right. There was slight repetition in your right ankle. Now I'm gonna go ahead and have you put your shoes and socks back on.
Okay.
Do you need any help?
Nope. I'm good. Thank you.
Okay. So everything was very symmetrical, no limitations, and everything looks good. Perfect. Okay, if you could just stand up for me, I'm going to feel your hips. Any pain?
Nope.
Okay, great. And we're going to take one step this way.
Okay.
I'm going to have you kick your right leg forward and kick it back. Any pain?
Nope.
And then out to the right and cross it over your other leg. Any pain?
Nope.
All right. And then one more, like you're climbing over a gate. Perfect. And back in. Any pain?
Nope.
Okay. Everything was symmetrical, no limitations.
Perfect.
And then I'm going to go ahead and have you do the same thing with your left foot. Kick it forward and kick it back. Okay. And now out to the side and cross it over. Any pain?
Nope.
All right. And then over the gate and back in. Okay. No pain?
Nope.
Okay. Everything was symmetrical, no limitations, and no crepitations.
Perfect.
I'm going to go ahead and feel on your spine. Any pain?
Nope.
Okay, I'm going to go ahead and have you touch your toes as far as you can. Okay, and you can come up. And then can you go ahead and reach your left arm down towards the ground? Perfect. And your right arm down towards the ground? Perfect. You can come up, and then can you act like you're going to be doing a back bend? Perfect. You can go neutral. Okay, that was great. Everything's symmetrical and everything based off your shoulders and your hips is even and no limitations and no crepitations. You can go ahead and sit back down.
Okay.
Now I'm just going to finish by testing your strength. Is that okay?
Yep.
Okay, I'm going to push on your arms while you try to lift them up. Perfect. And then try to push them down. Perfect. Strength is good. And I'm going to go ahead and push on your legs, try to kick them up. Perfect. And try to bring them back down. Great. Everything looks perfect, and you had a great exam. Thank you.
Thank you.
Is it okay if I call you Randall?
That's fine.
Okay. I'm gonna check your palpate, your team J. If you could open and close your mouth. Good. So he's not having any pain. You're not having tenderness with that, are you? And I didn't feel any kind of locking or clicking or anything like that. So his team J is moving well. Now if you just don't let me open your mouth. Good. So that tells me his cranial nerve number 5 is intact. So next I'm gonna go ahead and get you to open your jaw and move it side to side, in front and back. Good. So he's good range of motion in his jaw. So next I'm gonna go ahead and get you to stand up, and I'm gonna check your cervical, thoracic, and lumbar spine. So his spine is normal alignment, is in anatomic alignment. I don't see any kind of deviations from one side or the other. No obvious bulging or anything like that. So if you can go ahead and bend forward. Good, and back up. So I don't see any kind of obvious signs of scoliosis, lordosis, or lordosis, scoliosis, or kyphosis. It seems to be no obvious abnormals in curvature, normal curvature. So next I'm going to go ahead and palpate. Let me know if you have any pain.
No.
So no pain along the spinal route. He's not having his muscles appear to be firm around his spine. I don't notice any kind of swelling, no obvious bulging in one side or the other. So his muscles around his spine are good. So next I'm going to get you to face the camera and check your thoracic range of motion. So if you can bend forward and touch your toes. Good, and hyperextend back. Good, and lateral bend side to side. Good, and rotate, trying to keep your pelvis in the same position. Good. Next, if you can come and sit back down. So next, I'm going to check your cervical spine. If you can do chin to chest, chin to ceiling, rotate, chin, rotate, and then ear to ear. There you go. So that is good. Next to it, against resistance, against my hand. Good, and up. Good, inside. Good, inside. Good. So his range of motion in his cervical spine is good, and his muscle strength was a 5. Next, I'm going to start looking at his upper extremities. So they appear to be symmetrical. I don't notice any kind of gross deformities. One arm is not longer than the other. His shoulders appear to be symmetrical. Elbows appear to be symmetrical, and wrists appear to be symmetrical. No obvious deviations or bulging in any of the joints. I'm going to palpate him. Are you having any tenderness?
No.
So no tenderness, no swelling, no warmth, no nodules on the elbows. So that is good. Next, I'm going to look at his fingers. So his fingers are intact. He's got all 10. I don't notice any kind of nodules or swelling in his finger joints. They appear to be symmetrical. Next, I'm going to check his capillary refill. Good, it's less than 3 seconds. So you can go ahead. I'm going to check his range of motion in his shoulders. If you can raise your shoulders up and back down. Next, against resistance. So that tells me his cranial nerve number 11 is intact. Next, I'm going to check your range of motion. If you can just extend your arms up and all the way up and back all the way down. And then hyperextend back. Good, and back to normal. Then abduct out all the way up. And abduct in. And one arm at a time over across your body. And back. Another arm. And back. Okay, next I'm going to run you, do it against resistance. So lift your arms up to the front. Good. And don't push down. Good. And then out. Push against me. Good. Next I'm going to do you through passive range of motion. Let me know if you have any pain with this. Any pain?
No.
Okay. Check this one. Any pain?
No.
Any pain?
Nope.
Okay. So that is good. So next I'm going to go ahead and do your elbows. So if you can just flex and extend them. So that is good, symmetrical, no obvious problems in range of motion. Now if you could just pull against me and push against me. Good, so his muscle strength is a 5. If you can go ahead, I'm going to run you through passive range of motion. Let me know if you have any pain.
No. Nope.
All right, and next I'm going to check his wrist. So if you can just hyperextend and flex. Good, any pain with that?
Nope.
All right, I'm going to run you through passive range of motion.
Nope.
And then against resistance, so pull down, bend up, or just your wrist, There you go. Okay, now I'm going to get you to abduct all your fingers out and abduct them in. Then do thumb to finger, so good. And then finger to the fifth metatarsal, so that is good. Make a fist, good. And eversion in and eversion out, good. All right, so next I'm going to get you to squeeze my fingers, good. Can you pull against me? Try to extend your fingers, good. And then extend your fingers, don't let me try to push them in. Good, so that is good. You can put those down. So his passive and active range of motion in his wrist and fingers were the same, and his strength in his wrist and fingers were 5. So now I'm going to go ahead and look at his, check his sensation in his arms. Tell me what you feel.
Sharp. Dull. Sharp.
And what arm was that?
Right. Dull. Sharp. Dull. Sharp. Left
Good.
arm.
Good. All right, so next we're going to go ahead and check your reflexes. So first I'm going to start with your brachial reflex. Just try and relax. Then I'm going to do your tricep reflex. Good. And then I'm going to do your brachial radialis reflex. Good. Tricep reflex. Good. And bicep reflex. Good. And brachial radialis reflex. Just try and relax. Good. So that is good. Reflexes were +2. One other thing I want to do to check your range of motion in your wrist is supination and pronation. So that is good. All right, you can rest your arms down. Next, we're going to go ahead and look at his extremities and his legs. So his legs look symmetrical. One doesn't look longer than the other. I don't notice any kind of bulging in the knees, ankles, or hips. No pain on palpation, no nodules, no redness, no warmth, no tenderness, or anything like that. So that looks good. Next, I'm going to go ahead and get him to lay on his back and check his range of motion. So if you can just lift your leg up to the ceiling, good. And knee to chest with this leg, good. And up to the ceiling with this leg, knee to chest, good. I push against my hands, good. Good. Now I'm going to walk you through range of motion. Let me know if you have any pain.
No.
Good. And bend now.
No.
No range of motion, no pain with that.
No.
Good. Abduct your leg out, one at a time, one at a time. All right, and this one against resistance. Good. And this one against resistance. Good. And then passive range of motion. All right, and then turn over on your belly. So his passive range of motion and his active range of motion were the same. He didn't have any pain with movement, and his muscle strength was a 5. If you can just lift your foot up to the ceiling, keep your left knee straight. Back down. This one. Back down. Now I'm going to do passive range of motion. Let me know if you have pain.
No. Nope.
All right, and turn back over. So passive range of motion is intact, active range of motion intact, muscle strength is 5. So now if you can go ahead and stand up, we're going to check your knees. So just stand and face towards me. Okay, and hold on. So I want you to flex your knee back and then extend. Good, and then the other arm flex back and extend. Good, and then do it against, I'm going to run you through range of motion. Tell me if you have any pain. Good.
No.
Good. Now, let's do it against resistance. So don't let me lift, don't push down. Good. And this one, push down. Good. All right. So his range of motion, active and passive, were good. You can have a seat. And his strength was a 5 and bilaterally. So next we're going to go ahead and check his feet. So if you can go ahead and dorsiflex your feet and plantar flex. Okay, good. And then inversion, eversion. Good. And then rotate. Good. So now I'm going to get you to do it against resistance. So pull up, push down. Good. So that was symmetrical, muscle strength of 5. So next I'm going to get you to extend your toes, curl them. Good. So that is, his toes are good strength. So he has all 10 toes. I don't notice any kind of deformities or deviations or curvatures or anything in his toes. I'm going to palpate his Achilles tendons. It's symmetrical, no obvious increase in thickness, no tenderness, no obvious injuries. His capillary refill is less than 2 seconds. On his toes, next I'm going to go ahead and check your reflexes. First I'm going to start with Achilles. So I'm just going to check his Achilles reflex. That was good. Here we go again. That's good. Now relax. Go and check your patella reflex. Good. Good. So his deep tendon reflexes were +2 bilateral. Tell me what you feel.
Sharp. Dull. Sharp. Sharp. Dull.
All right, if you can stand up. So when he stands up, he has normal position. His tibia and femur angle is less than 15 degrees. His weight is medial midline. He doesn't have any obvious deformities or curvatures in his toes, so that looks good. His feet look symmetrical when he's bearing weight and when he's non-weight bearing.